Hello, everyone. My name is Andre Gonzalez, better known as Andy, and I am delighted to be here today to discuss one of my favorite topics and new programs that I've developed over some time now, entitled Gardening Your Organization. Prior to continuing on with this program, I do have a disclosure that I do have some financial interest arrangements or affiliations with some of the organizations or businesses discussed in this PowerPoint. If you have any questions regarding those affiliations, please feel free to approach me after the presentation for further information. So, some background information regarding myself. I've been in the healthcare business since 2008 when I took my first job in a healthcare system as a patient transporter at Memorial Healthcare Systems in South Florida, one of the major systems in Broward County. And my main role at this hospital healthcare system was to be a patient transporter. I was the guy who, in the diagnostic imaging center, they would call and say, "Hey, Andy, go pick up patient in room 235B for an x-ray." That's the doctor's orders. I would have to go pick up the patient, bring them to x-ray, and then return them back to their room safely. If it wasn't for this system, I would have not been able to make it through undergraduate without their assistance and tuition waivers. After I graduated from Nova Southeastern in 2013 with my degree in a Bachelor's of Science in Athletic Training, I took a 1 year residency at the University of Maryland where I worked primarily with their wrestling program and learned to get my hands on and my technical skills acclimated to being a clinician on my own without having a preceptor oversight. After Maryland, I went to the University of Memphis, where I became a graduate assistant athletic trainer, working primarily with their men's soccer program as well as their men's tennis program. While there at the University of Memphis, I worked as a GA, meaning that my tuition was being paid for in part for my work. So I obtained my Master's of Science in Sports Commerce and Health Sciences while at the University of Memphis. After Memphis, I took my first adult job as a clinician without going to school at Florida Southern College. This is an NCAA Division II school. I was there for 4 years. I started in 2016, and around 2019, 2020, when COVID hit, the pandemic hit, things began to change, and I felt the need that I needed a change of scenery and needed to be closer to family. So I took a leap of faith and took a job closer to home in Miami, Florida, with Baptist Health, South Florida, in their orthopedic and sports medicine department. There, I worked as a physician extender, which was also a athletic trainer certified position. And I worked alongside our physicians. Our physicians took care and currently take care of a lot of the major sports teams here in South Florida. This includes the Miami Heat, the Miami Dolphins, Inter Miami. Pretty much everybody here big in South Florida uses this medical group. After a year there, I ended up learning to love and appreciate the leadership, my coworkers, the physicians, the chemistry and relationships I created there. But I wasn't happy with what I was doing. So I took another leap of faith in 2020 and took a job at Florida International University in Miami, where I currently work as a athletic trainer in their athletic training services department. This is a clinic that's open to the general student population here at FIU who are in need of orthopedic evaluations or therapeutic interventions. So the question becomes then, why am I here? What am I here to talk to you guys about? What is it that is so close to near and dear to my heart? That's easy. It's turnover. It doesn't matter what profession, what industry, what level. Turnover has become almost like a disease in a variety of settings and professions, as I said. One of as you can see on the slide, I've listed a few causes here. Some of the causes include burnout, underpaid, undervalued, where companies have not increased payment to their employees due to inflation. Other things include leadership, staff shortages. With staff shortages comes higher work volumes for those that are still employed by the specific organization. Illness, this can be both mental and physical or both. Time. This is one of the biggest things why people leave their jobs because of a lack of time with work-life balance, missing out on on their children's events, missing out on family events and things that are important to them. How does this affect your company or your organization? I'll give you just three key insights, even though there's a lot more to this. Some of the effects are caused by productivity and efficiency. Productivity and efficiency, in the sense of due to the shortage of staff and the lack of um, personnel, you may not be able to provide the same quality of service to your clients, which in turn may cause a turnover in your clientele. There's another thing called the weed effect. Nothing. There's an old saying that it only takes a few bad apples to ruin the bunch, and this can happen in any kind of organization, any size. So if you have unhappy employees, little by little, this may cause a ripple effect in your team's dynamic and cause people to want to leave as well, meaning poor quality, poor performance on your organization's end. And then there's costs. What Think about your own companies and what's the cost of keeping an employee versus hiring someone new and training them. How does that affect not just the payment of that employee, but what's the total value loss with that seasoned veteran that already knows the system, that's already bought into your culture and into your company's missions. Here on this slide, I want to give you three key growth factors that you can think of when your company has a garden. So for a flower to grow, there's these kind of three elements. There's more, obviously, but these are the three I kind of want to point out to you. The first one is good soil. What does that translate to your organization? That means good soil is where your roots are going to be planted. That means that your employees are bought into your mission and your vision of the organization's culture. And then comes the idea of recruitment. Are you bringing in people that are there just to use your company as a stepping stone, or are they employees that are going to be there for the long run? The next key growth factor is sunshine. Everybody's attitudes and everything can be referred to as a sunshine of light or a doomsday of a cloud. But in this analogy, I'm referring to your company's brand in the workforce. What are other employers or employees saying about your company? Why do they want to come work for you, or why don't they want to come work for you? Why are they leaving your company? Along with, what are the benefits and staff rewards do you offer to their employees? And lastly, but not least, probably my favorite and most important one is watering the plants. Obviously, for a plant to grow, you need the soil, the sunlight, but the water. This is what helps bring the nutrients to the company to continue to grow. How does that translate to your organization? Easy. Investment in your team. What are you investing into your team members for them to be woven into the fabric of your organization so that they stay and that relationship is a bonding relationship for a long run, as well as clear communication. Are you making sure that you communicate with your team members and your team and your staff members and your leadership to try to drive the mission forward? And like I said earlier, I want to give you some more thinking points that you may have not considered on potential reasons for turnover rates. Food for thought here. Have you ever thought of a leadership reform where you gather all your leaders and take a introspective look at your company as a whole? Have you reanalyzed your recruiting strategies and methods? Have you looked at the way you engage with your staff members or your teams or your employees? Have you looked at the culture of the organization? Is it time that you guys reanalyze your mission or your vision of where the company is trying to head towards in the next 5, 10, 15-year plan? Or that also goes with the idea or the image of what you want your branding to be for your organization. And again, as I've mentioned before, employee investment. And I present to you a third option that most HR groups or companies can't really think of or don't consider, is using the current employees that you have to help you recruit and retain the employees you do have. This is called a grassroots program that my company does very well with. We look at your current employees and how we can change that environment to retain people that are loyal to your company. So the question becomes is, what does my company do, or what's my company? Again, a reminder, my company is Retention Strategies LLC. We're a company that strives to provide companies with introspective reports on their positive and negative tactics for retention and incentive or investments into their employees. We work with a number of industries, not just healthcare, but we also work with the tech industry, business, secondary education, as well as the service industry and hospitality. This company also strives itself on helping companies come up with grassroots initiatives to help these companies to increase their retention rates compared to their competitor. So I hope this presentation has been very informative for you and has made you as a leader think about some of your tactics within your own organizations and your own leadership styles and your own methods of, why are people leaving my company or why people are leaving my organization. Nobody ever likes to dispute their dirty laundry out there, and that's fine. With my company, we're more than a private company to help you reach your ultimate goals of retaining these qualified individuals. So I leave you with this quote, which is one of my favorite quotes, that says, "The grass is greener where you water it." So the question I ask you is, are you watering your grass? If not, contact me and my team. So I hope this